Hi everyone, today we're going to be talking about an overactive thyroid, also known as hyperthyroidism. We're going to be covering the causes, symptoms, diagnosis, and treatment, as well as the anatomy of the thyroid. Alright, to start we're going to be talking about some of the anatomical features around the thyroid. The first one is the epiglottis,
which is located here.
and that prevents food from entering the larynx, which is located
Here.
And then we also have the thyroid gland, which is going to be what we're talking about a lot in this video. This one is actually the left lobe. There should also be a right lobe on this model, but that's not present at this time. Now we're going to start talking about some of the causes of hyperthyroidism with Roxanne Fay.
The first cause I'm going to be talking about is Graves' disease. Graves' disease is when a person's immune system sends antibodies that cause the thyroid gland to overproduce the hormone TSH. The second and most common cause are thyroid nodules, which have two types: toxic unonodular, which is only a single part of the thyroid that is attacked, and then toxic multinodular, which has multiple parts of the thyroid that is attacked, which is because of the overproduction of THS. The third type is thyroiditis, or inflammation of the thyroid, and it has two types. The first type is autoimmune, in which the thyroid is inflamed, and leads to spillage of THS into the bloodstream. And then the second type is subacute, in which it's just the inflammation of the thyroid. What makes this happen? The rate that T4 and T3 are released are controlled by a person's pituitary gland and the hypothalamus. The hypothalamus sends signals to the pituitary gland, which causes this hormone, TSH, the thyroid stimulating hormone. When a person has too much TSH, that means there is too little T4 and T3 in their blood, which causes hyperthyroidism. The thyroid, this bow-tie-shaped organ, regulates the production of hormones based on the amount of TSH it receives. The chances of developing hyperthyroidism are 8 times more likely in women between the ages of 20 and 40. Also, if you have a family history of Graves' disease, and if you smoke.
Next, we're going to be talking about symptoms with Sierra Manning.
As we've learned previously, overproduction of T4, which is also known as thyroxine, causes hyperthyroidism and has adverse effects on our metabolism. But how can a person tell that they are having symptoms of an overactive thyroid? Symptoms of hyperthyroidism varies from person to person. Many people have body experiences, which are symptoms such as sudden weight loss, rapid or irregular heartbeat, fatigue, sweating, and body tremors, muscle weakness, hair loss, puffy eyes, diarrhea, and increased perspiration. Also, women will sometimes experience irregular menstrual cycles, which means that they have like lighter flows that can occur less frequent than the average woman. As far as mental symptoms, a person can experience nervousness, irritability, anxiety, and insomnia. When seeking help, it is important that patients are honest with their doctors. About their symptoms, because their unique symptoms can help doctors discover the disease and then to run the tests. Without treatment, it can cause individuals to experience heart and bone problems later in life, as well as a dangerous condition called the thyroid storm. Thyroid storm causes individuals to have very high heart rates, as well as high blood pressure and high body temperatures. Some fun facts about the disease is actually that there is an estimated 20 million Americans with some form of a thyroid condition. Of those, about 60% are unaware of their condition. Next, we're going to be talking about diagnosis with Brittany Jones.
I'll be talking about the diagnosis of hyperthyroidism. Doctors take numerous steps to determine if the patients have the disease, and there are also several methods to determine if you have this disease. Examinations the doctor may do to diagnose hyperthyroidism in a patient may be the doctor will do physical exams, on the patients, such as checking for an enlarged thyroid. The doctor will check for the enlarged thyroid by feeling the throat, and if it feels bumpy or abnormally large, then the doctor may conclude that the person may have hyperthyroidism. Other physical examinations include checking for body tremors, he will also may check for appearance and changes in appearance in the eyes, which the eyes may look a little bit like this. They may be bulgy and they may look abnormally large, clearly. Another thing that the doctor may check for is an overactive reflex, which the doctor will have you sit down and he will test your reflexes with a reflex hammer. He'll tap your knee, and if your reflex exerts too much, then that may also be an indication that you have hyperthyroidism. Other methods a doctor may conduct are different blood tests. To see if the TSH, which is thyroid stimulating hormone, levels are low. And the doctor may also test to see if T4 is elevated. These tests may have to be conducted several times. To receive conclusive results. After blood tests come back abnormal, the doctors may conduct further tests such as the radioiodine uptake tests. What happens here is the doctor or technician may give the patient a pill or liquid form of this to see how much is absorbed by the thyroid. And during a thyroid scan, which is another thing they may do, they will be able to see the size, shape, and position of the thyroid. Next, we're going to be talking about treatment with Emily Kendrick.
The first type of treatment for hyperthyroidism is medication. The medication used for hyperthyroidism is radioactive iodine, and another is antithyroid medication. Both medications help the thyroid gland in their own way. Radioactive iodine, it causes the gland to shrink. Also, it reduces the symptoms that have appeared with the thyroid gland. Finally, the antithyroid reduces the symptoms of hyperthyroidism completely. With radioactive iodine, symptoms can subside within 3 to 6 months. Now with the antithyroid medications, it reduces the symptoms by stopping the thyroid from producing hormones. The next form of treatment, if medication does not work, is to go see a specialist as an endocrinologist. An endocrinologist is an expert in the endocrine system, which is where the thyroid gland is located. So with an endocrinologist, they'll know exactly what treatment to do for it. If you go see a regular doctor, it really doesn't work because a regular doctor can only monitor your thyroid gland. They don't know what type of treatment you will specifically need. Since surgery is the last and final option for treatment, however, it is not as bad as it seems. Since it is the final option, most of the thyroid gland, or all of it, will be removed in the process. This type of surgery is also known as a thyroidectomy. First thing they do, they put you under general anesthesia. Second, they make a small incision in the skin. Third and final thing that happens in the surgery, muscle and tissues are pulled aside then to expose the thyroid. After a person's treatment is done, whether it was with medication or surgery, continue seeing a specialist to make sure the treatment is working. If you have had to have surgery, within the surgery, people recover within 1 to 2 days. However, if a problem pops up, continue seeing a specialist often.
So to conclude today's video, I hope that you all had the opportunity to learn about the various causes, symptoms, diagnosis, and treatment of hyperthyroidism and how it can affect a person.
You're probably asking yourself, what does the thyroid do? The thyroid and what?
Oh my god.
Okay. I get nervous and I get panty, okay?
The doctor will do...
Also, women will also sometimes
Itis, right?
Alright, we're going to be talking about some of the anatomical features around the thyroid, and to start, I'm going to show you all the epiglottis,
Which is located here.
and then the next part is the larynx, which is there.
So, you're probably asking yourself, what does the thyroid do? Why? I think
No, I didn't. I'm sorry. I should have asked if...
Did you start it? Oh. Yeah. I didn't hear the thing.